with the help of colleagues from both the Culinary Institute and the Harvard School of Public Health, we identified initially 26 thought-leading institutions with kitchens who were using kitchens as catalysts of personal and societal health enhancement. The kitchens were really viewed as the vehicle to teach people about food, nutrition, new habits, but they're all different.
We at the University of Cincinnati Academic Health Center are very fortunate to have been able to partner with an organic farm, Turner Farm in Cincinnati, to think about the teaching kitchen in the middle of a farm, and then bringing children there, and bringing students there, and bringing community members there between an organic farm and an academic health centers that I think should, I hope, be replicated, should and could be replicated around the country.
So our teaching kitchen at the Alphons Center for Health is an impressive setup, I think, especially for Central Maine, because we have a camera system set up where we can project the images of whatever's being done on the cooktop or on the countertops that the chef is doing into large screens that can be viewed throughout the entire center. So someone sitting at the back of a 400-person facility can see what's cooking on the cooktop. And we also have the ability to do some recording of some of those things, and so we're working on that technology piece right now to be able to save some of the cooking demonstrations that we're doing to show for patients later.
Teaching kitchens are an important tool really in improving the health of the community, because we're finding that many people never really went through home economics classes. They didn't have these hands-on classes. And also, they're not confident that they can try new foods or new ways of cooking to improve their health. So here's an opportunity for them to get in, try a technique, try new foods, and then implement it at home for better health.
I've realized how powerful that hands-on group experience is, because I have had patients come back who've said, I learned that I should be using whole grains, and telling me these amazing things that they learned how to cook. And I realized, for years I've been saying these things, but it didn't mean anything in a one-on-one doctor visit. But when they learned how to cook it, made it, then did it again at home, that's actually sticking. And I've seen people make really powerful health changes.
In addition to that, we're really hoping that we can show that it does change health outcomes in selected patient populations, both in a preventive way, but really targeted in our sickest patients. If we can use food as medicine and show that it's adjunctive to all the other things that we're doing, and will help to give people a better quality of life.
Currently, our program right now is all philanthropy, but we're doing research right now to try and convince our care coordinated organization that using a teaching kitchen is a cost-effective way to help our patients with diabetes. Is our first group that we're reaching out to them for.
Teaching kitchens are really an integral part of our strategic business plan called Envision 2020. And the mission behind Envision 2020 is to really make it easy for our customers and clients to make good food choices, to create an environment and experiences that foster a sense of well-being, and to create a sense of community. And teaching kitchens help do all three of those things.
Specifically, we work with health professional students, undergraduates, people who are getting involved in health coaching. As much as they know about health and nutrition, cooking is a way to bring that to life and to do something that I call applied nutrition, where they're actually taking this information and turning it into something they can do and share with others.
We have a program through one of our coordinated care organizations that delivers healthy meals to burn victims or people with chronic wounds, because we know that they won't heal as well if they're malnourished. We have Medicaid paying for some pregnancy nutrition classes. So Oregon is really, I think, pushing ahead with how to treat health through nutrition.
So for an organization that is considering building a teaching kitchen, I would say that we have a wonderful group of colleagues all around the country with teaching kitchens in hospitals, in medical centers, in community centers. We have a lot of models to look at, and wonderful models with wonderful research coming out for really changing the way we think about food, how we teach our children to cook food and learn about the values of food, thinking about the way our medical students, our nursing students, our pharmacy students think about lifestyle early on in their training. It's an enormous capacity to actually train not only our community members, but our next generation of healthcare professionals to think about food, to learn about the benefits, to actually learn the skills. So I actually can't think of probably something that could have a bigger capacity. If we were to put these into all of our schools, our community centers, our medical centers, our facilities for teaching, the amount of change is enormous. And so I would just invite people to meet the Teaching Kitchen collaborators. We don't need to reinvent the wheel. Meet some of the other members and find out what their kitchens are doing, what programs, and we can really scale up and make a real difference.